What's up, guys? Dr. Dan over here. Wanted to talk about a misconception about cracking your back yourself and what harm it can cause, right? So a lot of times people say, well, I crack my neck myself, and they'll just like put their fist here and they'll twist their neck, right? So I wanted to talk a little bit about the anatomy of the cervical spine and why you should never, ever do that, right? So in your spine, you have all these little bones. You have 7 up in your neck. In between these little bones, you have these little things called joints that kind of lock together with the vertebrae above and below, right? So in the cervical spine, you have about 14 going from the top down to the bottom, and I'm just talking about the facet joints in the back, right? Now, as a chiropractor, what we're trained to do, and what I do with each of my patients, we will palpate your neck or feel your neck for exactly what joint is stuck, swollen, tender, whatever it is. It's going to be inflamed, right? Many times you may only have 1, 2, 3 joints that might be a little twisted or a little irritated, and if you are at home kind of self-adjusting yourself, that's a very unspecific or a very just lackadaisical way of adjusting your neck. And generally what that's going to cause is ligament damage in the neck. It can cause further muscle damage and even cause nerve damage from all these little nerves that come out of your spine, right? So as a chiropractor, our job is to find those little restrictions and just treat the things that are sticky, right? Now, there's 2 kinds of joints. The joints that become hypomobile, which means they get real stiff and tight, and then the other joints that become hypermobile, which means they move too much, right? So if you've ever sprained your ankle and then you've seen throughout the years that you might have repetitively sprained that same ankle over and over and over again, that's because the ligaments and those joints, they become hypermobile. They move too much, right? So we never, ever want to adjust or treat a hypermobile joint. That means a joint that moves too much. We only want to treat the joints that are very stiff and stuck, right? And that's my job as a chiropractor, and any good rehab chiropractor will teach you the same thing, that you have to only work on the stiff joints. The hypermobile joints, you need to create stability. So we need to do some strengthening exercises to tighten up the ligaments and tighten up the muscles around the joint, right? So, bad thing to crack your own back or your neck or your low back, because it's very unspecific, and it can ultimately cause you more muscle damage, more joint damage, more disc damage, maybe more nerve damage. Get the help, the professional help that you should have to fix your body the right way. If you have questions about this, give our office a call or check us out online. We can help you to live happier, healthier, and more mobile, pain-free life.